An ankle injury can happen suddenly, and doctors say they can come in many forms.
There's two different types of problems we see: fractures or broken bones, and ligament tears or sprains.
Orthopedic surgeon Dr. Schwartz says the type of injury will determine the length of recovery.
So when people say, I twisted, I rolled, I sprained my ankle, that's a soft tissue injury, usually a ligament, sometimes a tendon. So ligaments attach two bones together and tendons attach muscles to bones.
With any kind of foot injury, doctors say patients typically don't need immediate attention, but they should use the Rice method to alleviate the pain: rest, ice, compression, and elevation.
If you have a little bit of bruising, not a ton of pain, you're able to weight bear on it, just hurts a little bit, we would recommend initially trying some rest, ice, elevation, and compression. And a lot of times, if it's better in a day or two, it probably was a mild sprain and nothing too much to worry about.
But if a patient is unable to put weight on the injured foot or notices the foot is crooked, it's time to get treatment.
A broken bone, believe it or not, rarely needs surgery in the ankle. So unless you break both bones around your ankle or one bone so severely that it moves, most of those can be treated in a boot or cast.
If surgery is required, patients are typically back to their normal routine in 6 to 8 weeks. For Lee Health, I'm Lindsay Fry.